So since it's National Childhood Obesity Prevention Month, I think it's really important to highlight that right now in the United States, 1 in 5 children is with obesity, and so prevention's key, and really thinking about what can we be doing through different periods of development to help our kiddos grow up happy and healthy. Jennifer Savage Williams. I'm at Penn State University. I'm a professor in nutritional sciences, and I direct the Center for Child Health Research. So many parents do believe that a bigger baby is a healthier baby, but the data really show that heavier children at an earlier age tend to grow up to be heavier adolescents and more likely to be overweight as adults. So prevention is really key. And it's really important to set healthy behaviors early in development so that they can track through the lifetime. In early development, one of the things that we study is responsive parenting, and what responsive parenting really means is looking for the signs that your child is providing about being hungry, being tired, and being able to respond to those in a sensitive way. So when we think about feeding, in early development, many parents believe a crying baby is a hungry baby, but babies cry for lots of reasons. So we help parents better understand their child's needs and then respond to those needs based on what the child is actually asking for. Because it's really easy to overfeed a baby, especially when bottle feeding. But because babies cry for a lot of different reasons, we teach parents to, dial in and look for the signs, earlier signs that a baby might be too hot, or maybe tired, or maybe just fussy. Maybe they need swaddled, and so kind of tiling into what the baby's trying to tell us versus just trying to feed them to kind of quiet them. They'll root, for example. There's rooting signs that they'll start to do. They'll start to, play and chew on their fingers and their hands. And we look for some of those earlier signs that a baby's communicating that they're hungry. And when a baby shows those signs, absolutely, we recommend feeding, but it's also equally important to stop feeding when the baby tells you that they're full. When we think about childhood obesity, we often think about calories and consuming too many calories or not moving enough. But it's really also important to be thinking about having access to healthy foods, especially when we have such high rates of food insecurity in the United States. So we not only want to set up our households and our kiddos and our families for success in terms of preventing childhood obesity, but success in the workforce, success in our classrooms and academic performance, which is really, really important, especially in early development. One of the things that we're doing here at the Center for Child Health Research is working to integrate care across clinical, community, and social services to really provide a more optimized service in the United States in the space of childhood obesity prevention to improve health and wellness of not just kids, but families.